Dr. Kevin Hanz at Hanz Aesthetic Plastic Surgery. I want to talk about one of our very common procedures, the Mommy Makeover. When I think about a Mommy Makeover, I think about those changes that affect the female body after pregnancy that have us seeking some aesthetic refinement, some improvement, typically in the breasts and in the abdomen or in the trunk section of the body. Every patient is different, and how we're affected by pregnancy varies from one patient to another. Therefore, our approach to a Mommy Makeover may be individualized. It may be customized for one patient versus another. Most commonly, it involves a breast lift, a so-called mastopexy, where we're rearranging the breast into a more youthful position. This can be done with or without an implant, and at the same time addressing typically loose skin in the abdomen, perhaps a little bit of stubborn fatty tissue that has crept into the waist flank region, and these can be combined as a so-called Mommy Makeover to provide a more youthful breast, a more refined tummy, and a smaller, more snatched waist, if you will. Regarding the Mommy Makeover, I am often asked when is the appropriate time for a female to consider surgery. I think it's important, number one, to wait until a time in which we're done having children. There's no reason that a female cannot have these types of surgeries and later go on to have another or subsequent pregnancy, but most of the benefit of the Mommy Makeover may be lost with subsequent pregnancies. After having a child, we need to wait at least 6 months to allow the body to recover from the recent pregnancy. Having said that, so many females are concerned about picking up a little one during that early childhood or early infancy time period. I often say we want to avoid, say with a toddler, picking up from the ground position, but a child can be handed to you, which allows you to have more of that bonding experience early in the recovery. So a few salient points regarding recovery. First and foremost, walking is always encouraged, and this will happen almost immediately, even the night of surgery. We don't want to exert the body beyond this for a period of 3 to 4 weeks, and we're also minimizing the amount of arm activity to really allow breasts to recover, assuming they're part of that procedure. Having said that, after about 3 to 4 weeks, we can start exerting ourselves more, and after 2 months, we're back to a full recovery where we have no restrictions and able to get back doing all the things that we want to be doing. Again, this is recovery associated with the Mommy Makeover. And the appropriate time is when we're done having children and we feel like we can take a couple of weeks to really recover, get ourselves well, and get back to life as we know it. The Mommy Makeover, like all of our procedures, is performed right here at our office location at 4525 Lemmon Avenue. We have a state-of-the-art surgery center attached to the clinic where we're able to safely and effectively take care of patients. Most patients find that they can go home immediately following these procedures, but we do offer overnight accommodation with one of our nurses in the event that a patient either needs or desires to have that overnight stay. All patients are seen the next day, whether that's first thing the next morning following the procedure if we stay, or at some point in the clinic after being discharged home. I also think it's important to know that every patient has my personal cell phone number. I check on patients the next morning, but encourage each and every one of you all to text or call with anything that may come up in terms of issues, questions, or concerns following your procedure. We're booking consultations quickly. You can reach us at the office, 214-908-3633. Those are complimentary consultations. We offer virtual consultations as well, and that process can be completed by contacting the office or through our website at drkevinhanz.com. I encourage you to follow us on social media, and I look forward to seeing you soon.